Good morning. My name is Amber Kiesling, and today I'll be presenting my research proposal entitled The Effect of Structured Family Education on Morphine Use in Hospice Care. Pain and shortness of breath are two of the most common and distressing symptoms experienced by hospice patients. Morphine has long been considered the gold standard for managing both symptoms and improving comfort at end of life. However, despite its effectiveness, many family caregivers are hesitant to administer morphine because they fear addiction, respiratory depression, oversedation, or believe that morphine can hasten death. These misconceptions often lead to delayed medication administration, unnecessary patient suffering, and increased caregiver anxiety. My proposed research aims to determine whether structured education provided by hospice nurses can reduce these fears or improve caregiver confidence in administering morphine safely and effectively. So, the background hospice care focuses on maximizing comfort and quality of life rather than curing disease. As patients approach end of life, pain and dyspnea become increasingly common symptoms that require effective symptom management. Morphine is one of the safest and most effective medications available when administered appropriately. Unfortunately, many caregivers have misconceptions around opioid medications. Common concerns include fear of addiction, fear of becoming or fear of giving too much medication, concerns about respiratory depression, and worry that morphine may hasten death. These fears often prevent caregivers from administering medication when it is needed, resulting in unnecessary suffering for patients. Hospice nurses spend considerable time educating caregivers, but there's limited research evaluating whether structured education significantly improves caregiver knowledge and confidence. My study seeks to address this gap in the literature. Problem statement. The problem addressed by this study is the misconception that regarding morphine creates barriers to effective symptom management in hospice. Many caregivers delay giving medication because they fear they could harm their loved one. These delays can result in unmanaged pain, increased anxiety, unnecessary emergency calls, and decreased quality of life during the patient's final days. As a hospice nurse, I have personally witnessed families hesitate to administer morphine because they believe it will hasten death. This experience inspired me to develop this research proposal to determine whether structured education can improve caregiver confidence and patient outcomes. Purpose and research design. The purpose of this study is to determine whether structured family education regarding morphine administration reduces opioid related fears and misconceptions while increasing caregiver knowledge and confidence. This study will use quantitative pre-test, post-test design. Participants will complete a questionnaire before receiving education from a hospice nurse. The educational intervention will include information regarding why morphine is prescribed, proper administration, medication safety, expected side effects, safe storage, and common misconceptions. 2 weeks later, participants will complete the same questionnaire to determine whether significant changes occurred following the educational intervention. Population and sampling. The study population consists of family caregivers of newly admitted hospice patients. These caregivers are responsible for administering morphine, monitoring symptoms, and communicating with the hospice interdisciplinary team. Approximately 40 to 60 caregivers will participate in the study. A convenient sampling method will be used. Eligible caregivers will be identified during the hospice admission visit. Inclusion criteria include 18 or older, English speaking, and being the primary caregiver responsible for administering morphine. Paid caregivers and caregivers of patients who are not prescribed morphine will be excluded. Recruitment will continue until the desired sample size has been reached. Data collection instrument. Data will be collected using a researcher-developed questionnaire. The questionnaire contains 20 items divided into 4 sections. Demographic education, or demographic information, morphine knowledge, opioid fears and misconceptions, and caregiver confidence. Knowledge and confidence questions use the 5-point Likert scale, and with higher scores indicating greater understanding and confidence. Fear questions evaluate concerns related to addiction, respiratory depression, giving too much medication, and the belief that morphine hastens death. Participants will complete the questionnaire before the educational session and again 2 weeks later. Unique identification numbers will allow pre-test, post-test surveys to be matched while protecting participant confidentiality. Data collection procedures. The hospice admission nurse will be the first to identify eligible caregivers and briefly explain the study. Interested caregivers will meet with the researcher to review informed consent and ask any questions before enrollment. After signing informed consent, participants will complete a pre-test questionnaire. Following the completion of the survey, the hospice nurse will provide standardized education regarding morphine use. 2 weeks later, participants will complete the post-test questionnaire, either during a hospice visit or electronically through an online secure survey. All paper surveys will be stored securely, and the electronic responses will be maintained in a password-protected database. All information will remain confidential, and only aggregate findings will be reported. Data analysis. The data collected will be analyzed using IBM SPSS statistics. First, descriptive statistics will summarize participant characteristics using frequencies, percentages, means, and standard deviations. Next, paired sample t-test will compare participants' pre-test and post-test scores. The goal is to determine whether the educational intervention significantly improved caregiver knowledge and confidence while also reducing opioid-related fears and misconceptions. Statistical significance will be determined using the p-value of less than 0.05. Reliability of the questionnaire will also be evaluated using Convax Alpha with a value of 0.70 or greater considered acceptable. Expected outcomes. I anticipate that the caregivers who receive structured education will demonstrate a greater knowledge, understanding morphine, fewer misconceptions, increased confidence administering medication, and greater comfort assessing pain. Ultimately, these improvements should lead to earlier symptom management, reduced patient suffering, improved quality of life, and reduced caregiver anxiety. This research may also support standardized educational programs within hospice organizations. Implications of nursing practice. This study has important implications in a nursing practice. Hospice nurses are often the primary educators for family caregivers. If structured education proves effective, hospice agencies could implement standardized educational materials during every admission. This would help ensure that caregivers receive consistent information regarding morphine administration and symptom management. Standardized education could improve patient comfort, reduce caregiver stress, decrease unnecessary emergency calls, and strengthen evidence-based hospice practice. Further research could expand this study by including multiple hospice agencies, larger sample sizes, and more diverse populations. In conclusion, pain management is one of the most important responsibilities in hospice care. Although morphine is highly effective in controlling pain and dyspnea, misconceptions continue to prevent caregivers from administering it appropriately. This proposed study seeks to determine whether structured education can reduce those fears while improving caregiver knowledge and confidence. If successful, this intervention has the potential to improve symptom management, enhance patient comfort, reduce caregiver anxiety, and strengthen hospice nursing practice through evidence-based education. Thank you for your time and attention.
Very good.